This week on Health Garage.
Prostate cancer is the #1 cancer among men. So at age 40, we recommend that you should start having your screening done. Should the doctors find that you have cancer, you're at an advantage if you can have early treatment, because early treatment will improve your outcomes. And you have a chance to be cured if you are diagnosed early and treated early.
Nze ni musawo wa kinnansi kati nakimanya nti obwo obulwadde sisobola bujjanjaba nenzija mu ddwaliro. Nsaba abantu mwenna n'abasawo mwenna ab'ekinnansi abajjanjaba abantu, bwe mulaba abantu ng'obulwadde temubasobola mubuleke, kuba nze nandifudde seegeziwaza ku ddagala. Nakimanya nti obulwadde sijja busobola, si bwange, saabusomerera. Kati mulaba mponye munnammwe.
November marks Prostate Cancer Awareness Month, a global initiative promoting education and awareness. Alarmingly, Uganda Cancer Institute Mulago diagnoses approximately 3,000 new prostate cancer cases annually. This statistic represents only a fraction of those affected, as prostate cancer remains the leading cause of cancer-related deaths among men. In this week's episode, we delve into the complexities of prostate cancer with a renowned consultant medical oncologist and sharing an inspiring survivor story. Subscribe to our channel, like, share, and follow us on social media for more informative content.
This is November, and this is the Prostate Cancer Month. Dr.Okuku. I am a consultant medical oncologist at the Uganda Cancer Institute. Every month has a particular cancer that we promote for information to the public, and November is particularly selected for prostate cancer. And so this month of November, we want to flood you with information regarding prostate cancer as an awareness campaign to all men out there. So we see almost 3,000 cases of new diagnosis of prostate cancer, and this is worrying. And remember that these 3,000 are the few men who are able to come to hospital. We believe there are many other men who are not able to come for one reason or another. So this number has been increasing over the years. We used to see 1,000 new cases, now 3,000. And remember that this is in addition to the previous years of patients who come in with prostate cancer. So they keep adding, it accumulates, these numbers keep accumulating. And so this is a worrying trend because of the increasing numbers of men. Why do numbers increase? I think #1 is we are doing lots of campaign to inform men about this particular cancer that now is the #1 cancer that is troubling men in Uganda and also in many parts of Africa. This, we believe, is because of the different information that we give out to the public through the media, and we want to thank the media that is doing this work together with us, making sure that men out there are informed about the prostate and about the risk of developing this disease. There are many other ways and reasons also why this is increasing, but also our population is getting older. As men get older, one of the risks is prostate cancer. We rarely see prostate cancer below the age of 40. So as we grow old, our life expectancy in this country has also gone up. I think you remember the statistics that were released indicating that our life expectancy is on the rise. And so we expect more men to be diagnosed with prostate cancer, because as you grow old, the risk also goes up. Well, where do most of our men come from? They come from almost every part of the country. There are some regions that contribute a very small number. Places like Karamoja, for example. We don't see a lot of men from Karamoja. We think that maybe they are not able to come over. But we also see men from many other parts, from Buganda. We see a lot of men from Western Uganda. We see a lot of men. And we also see men coming from our neighboring countries. So it's all over. Prostate affects all men all over the country. And we believe that with the regional centers coming up, all these men can be able to they'll be seen in these different regional centers. Gulu, for example, for northern Uganda, Mbarara for western Uganda, and Mbale for eastern Uganda, and West Nile will be Arua Hospital, Regional Referral Hospital. So that's government's plan to make sure that men do not have to travel very far to reach where there is care. So we divide symptoms of prostate cancer into two, early and late. The early symptoms can be common to the symptoms that affect men with an enlarged prostate. And by the way, men can have two situations going on in their prostate. One is just an enlarged big prostate that you expect with any man who is above 50 years. So any man above 50 years will naturally have a huge prostate, and so there are symptoms associated with that. And remember that this huge prostate could be non-cancerous, or it could be because there is cancer growing in your prostate. And as it expands, your prostate becomes bigger, and some of the signs include a man keeps going many times to pass urine. One of the ways to notice that you're going many times is at night. How many times do you wake up to pass urine? The other is when you take fluids or when you take any drink, you go many times. That's another symptom. We call that frequency. There are other men who cannot keep urine for a long time. We call that urgency. They go to hurry, they've got to run to go to the restroom to pass urine as quickly as possible. If that does not happen, the urine will come before they reach. We call that urgency. Sometimes there is pain while they are passing urine. We call that dysuria. Other times there is blood in urine. So some of those late signs are blood in urine. We have backache. That's when the disease has now gone to the bones and the back. That's the common site. Inability to walk. When this disease invades the spinal cord, the man may not be able to walk, or the man may have a fracture of one of the limbs or the back. So fractures can also occur in prostate cancer. So there are early and late signs, as I have explained. You cannot have a check done at your home. You need to come to a hospital. You need to see a health worker who will do a number of tests, but one of the ways is to determine whether your prostate is enlarged. And we call that a digital rectal exam. The doctor may request that he puts a finger through your rectum to feel for your prostate. Doesn't sound very nice, and it's a bit uncomfortable for most men, but it helps the doctor to determine how enlarged your prostate is and whether there are any abnormalities on the surface of your prostate. That's a very helpful test. The other test the doctor may ask for is an ultrasound test, and the ultrasound will measure the size of your prostate. They will determine whether your prostate is retaining, or your bladder is retaining some urine. Remember, the bladder is a tank. It stores urine. So it will be able to, the ultrasound will determine how much urine you're retaining. Ideally, you're not supposed to retain urine when you pass urine. You should empty, or if there is any, must be tiny amounts. If you retain a significant amount of urine, that may be a sign of enlargement of your prostate. And the doctors want to know why you are retaining. And most times it's because your prostate has enlarged. The ultrasound will also determine whether there are nodules within your prostate, and then it will measure the volume of your prostate. The use of volume is around 30. If it is bigger than 30, it may mean that there is a tumor or something that makes your prostate bigger. The ultrasound will also tell us about the bladder, whether your bladder has signs of infection. Men with prostate cancer will have signs of infection within their bladder. We call that cystitis. The other test the doctor will do is a blood test. We call that PSA, prostatic specific antigen. And that's a very important test, and nowadays it is being done in many places. Because of that test, we are able to detect cancer in many men. But that test does not work alone. It has to be interpreted by the doctor very carefully to make sure that it is not being caused by another problem within your prostate or bladder. So briefly, those are some of the tests that the doctor will be able to do when you visit a hospital. So men should start checking or screening at age 40, especially if you have a family history. The cases of father and son prostate cancer are becoming common, and so we advise that at 40 years you should have your baseline PSA done. When it begins to go up, then we begin to get concerned that there may be a reason why it's going up. So at age 40, we recommend that you should start having your screening done. So how do you reduce the risk of prostate cancer? One of the things that we do generally is that if you have a family history already, your dad or your sibling, your brother or your uncle has a history of prostate cancer, we designate you as a high-risk person. If you have 2 family members, your risk is even higher. If you have 3, it's even higher. If you have 4, it's 100% you will also develop the same disease. And so how do you cut that risk? One is we may not completely eliminate the risk of developing this cancer, because one of the reasons is that you're carrying the genes. It's hereditary. So you carry the same genes from your parents. And so we want to catch the cancer early. That becomes our priority. So we ask you to keep coming for checkups, or what we call screening, at least every year. We ask you to come over and have a check so we can catch it early. But generally, there are things you can do to cut the risk of cancer. Having a good diet, making sure you're having plenty of fruits and vegetables, regular exercises, keep a healthy weight, do not eat too much red meat, too much processed meats. Those will put you not only at the risk of developing cancer, but other non-communicable diseases like diabetes, hypertension, dyslipidemia, or high cholesterol for that matter. And so we advise that try to keep a lean body, avoid smoking, avoid alcohol, generally try to be healthy as much as possible. In this, when you do this, it doesn't cut your risk to 0%, but may reduce your risk of developing many of these diseases, including cancer. So men should not fear to come have these checks, but should the doctors find that you have cancer, you are at an advantage if you can have early treatment, because early treatment will improve your outcomes. And you have a chance to be cured if you are diagnosed early and treated early. Men who come late and are diagnosed late, your chances of dying from this disease is actually high. And so the earlier the better. We encourage you. Of course, every treatment has side effects, but again, when you come early, the side effects are much less because we use less toxic treatments when the disease is at an early stage. There are ways to mitigate side effects related to treatment, but I think men should not focus more on the side effects. They should focus more on getting better and conquering the disease. There is a lot of research going on. I think one of the newest that was published in the past year was that men can be cured if they are diagnosed early with prostate cancer by using radical or newer radiotherapy treatments. So those newer radiotherapy treatments are effective and are now able to cure men with prostate cancer early. What are some of the things that keep men away from coming for treatment? And we call these myths or misinformation. Number one, if you are diagnosed with prostate cancer, cure is possible. It's not a death sentence. However, you need to come early. So you can be cured either by surgery, you can be cured either by radiation and hormonal treatment combination. Okay? You will not be cured by using herbal treatments. I haven't seen personally, I've been practicing for many years. It only keeps the disease silent for some time, but doesn't cure. Eventually you need more effective treatment. So the treatments that we use for prostate cancer treatment are well researched on. The treatments that you find at the Cancer Institute are well researched. We have some of the latest radiation treatments. A state-of-the-art linear accelerator called a TrueBeam is available. We have brachytherapy treatments. All these are modern treatments. Hormonal treatment is not used solely alone. We use it in combination with radiation and other treatments. There are newer treatments that are oncoming, like lutetium, that we use for men who are advanced, have advanced disease, to keep the pain under control. Those are also coming through. So those are some of the newer treatments. But generally speaking, early prostate cancer is treated with treatments like surgery, where we cut out to remove the tumor, using either laparoscopic or robotic treatments. All these treatments will soon be available, like the robotic treatment, which is one of the most preferred treatments for treatment of early prostate cancer. Generally speaking, most of the men are diagnosed between 60 and 70 years of age. That is in this part of the world. There are a few cases of men who are in their 50s and a very small number of men who are in their 45s. The ones in their 45s or 40s, they tend to have very aggressive disease. They also tend to have a family history of prostate cancer. The men who are in their 60s and 70s, as I've mentioned, are the majority of men. However, we believe that the cancer starts at an early age, because you can have prostate cancer beginning 10 years earlier, or even 7 years earlier, or even 5 years earlier, depending on how aggressive it is. So that's the reason why we need to check you early. If you come early, you need to have an early check when you're in your 40s, such that we can be able to catch the disease at an early age, because it starts to grow early and then keeps around and manifests between 60 and 70 years of age. So all men, if you're above 40, you need to come and have a check. However, we also tend to even filter more. And our filter is, we say, do you have frequent urination, frequent infections of the bladder? You're seeing doctors for pain on passing urine, you're seeing blood. We filter, those are the most of the men we need. If you have those particular symptoms, urinary symptoms that bother you frequently, you see a doctor today, next week, next month, you come back with the same problem, you are the person of interest we are interested in. You are the one we want to see. Is masturbation associated with prostate cancer? No. Is sex associated with prostate cancer? No. There is no evidence for that. Circumcision, no, there is no evidence. There is no medical evidence that pins these three kinds of procedures to prostate cancer. So you don't have to worry whether you're planning to be circumcised. It's not associated at all. So we encourage men to come for the right information with the experts. There is no scientific evidence that procedure or that habit alone is associated or will reduce your risk. There is nothing of that. Key things before, as we finish, number one, prostate cancer is the number one cancer among men. It's increasing. If you're a man and you're listening, you need some action. But I want to sound out men who are having symptoms, frequent urinary symptoms, and these are bothering you. Maybe there is something we need to find. So we want to encourage you to come. If you're having these problems, infections frequently, please do come for a check. Because if there is something, we catch it early, cure is possible. The other thing is the men with a family history, father, son, brother, and those have had prostate cancer, that one you should have come yesterday, because the risks and in these families, we tend to see very high risk in families that have a history of prostate cancer. So again, those men are high risk, they need to take particular interest. Diet, exercise, very important. Try to do regular exercise, keep a healthy diet, do not smoke, do not drink, avoid too much fat, avoid too much sugar, and that, by doing that, you should be able to cut a significant number of non-communicable diseases. Nutrition plays a big role when it comes to disease, very big role. You eat badly, it can make you sick. So do not take diet lightly. If you put on lots of weight, it will make you sick, not only from cancer, but from other non-communicable diseases, diabetes, high sugars, high cholesterol, obesity, putting on too much weight. All this will put you at a bigger risk of disease. So nutrition is very important for men. There are particular foods that we recommend men with prostate cancer to take a keen eye. One of those is things like carrots, things like watermelon, things like cherry tomatoes. Cherry tomatoes are not common. They are the tiny small tomatoes that have an ingredient that may help prevent prostate or cut the risk of prostate cancer. Strawberries and all these fruits that have antioxidants, high levels of antioxidants. All the berries, those kind of things are very helpful in fighting the risk of this disease.
You're watching Health Garage. In our feature story today
we are inspired by Mr. Sekawula Augustine, a 64-year-old prostate cancer survivor from Rakai district. He shares his remarkable journey from diagnosis to treatment and recovery, highlighting the importance of early detection and quality care from Uganda Cancer Institute.
Nze mwami Sekawula Augustine. Zalibwa ku kyalo bakiyita Kiswaga Lukyamu mu Lukakamu Kalo Gombola byakabanda disitulikiti Rakai myaka 64. Nasooka kulwala amagulu n'enzimba nga sikirabanga kw'ebigere bwe byava ennaku 3 ne bituuka mu ntumbo n'ebisambi enzimba n'obuluuto n'ekifuba. Kati bwe nalwala ne neebaka owaka ne ndaba obulwadde obwo nga sibutegeera bulungi. Nina omwana omuvubuka eyajja nannonanga weno Kampala ne ngenda dokita oyo nampima kati dokita bwe yakebera nampima nakebera obulwadde bwange prostate nali nfuyisanga omusolo tegujja nange nali muliraanye n'agamba nedda nti obulwadde teweeraliikira mukulu ogenda kuwona kana akakwata katono kati ebbaluwa zange ezimu zaali ziraga nti mu mubiri gwange ogw'obusajja mwenfuyisiza mwalimu oba enkovu oba akantu akazibikira omusulu kati yapima n'alaba prostate nga yazimba oluseke olufuyisa omusulo nga yalwebakira ne lwenyiga bwe ruti kati ng'omusulo ne gufulootinga ne gudda munda wange ne gutandika okuzimbya ebigere okuva wansi mpaka waggulu n'olubuto n'omutwe nali nzimbye n'ekifuba naŋŋamba obulwadde buno prostate ye yazimba naye osobola okufuuyisa nandeeta emulago bankwata ebifaananyi nze leero nzijanjabira malwaliro g'ewaffe nasookera ku ddwaliro erya Mwami Lubowa kiriniki ye bagiyita Miraani endejje namalawo ng'essande nga ndi mu mbeera mbi nnyo sikyasobola nakwetuza ku kitanda Mwami Lubowa era mwebaza ow'endejje naŋŋamba nzuddemu obulwadde walwala gundi eno prostate naye erabika eri mu kansa naye yakakwata singa kyetaagisa okulongoosa dokita oyo naŋŋamba yandinongoosezza naye n'agamba tagenda kwegeziwaza alaba nkyali mu omugaso mu ggwanga naŋŋamba ngenda kuwa ebbaluwa naye totya nemugamba ndi mugumu n'agamba ngenda kuweereza ku Referral Hospital Mulago bo bakujjanjabe nampa n'ekifo mu ddwaliro lye bwe nzija wano bwe nzira yeewuwe era yakikola dokita oyo n'abasawo bembeebaza mwebale nnyo bwe nzija Mulago nasookera Mulago wansi nalina abantu bange olusinga 15 omwaka guno 2024 najja nalwala mu Gwokusatu najja Mulago eriyo endejje nga 23 mwezi gwali Gwakusatu ne mmalawo essande emu dokita oyo nampositinga wano e Mulago kati badokita baakeberawo nali nazimba nnyo nga ndi mu ssaawa yakufa ne bakola examining ku bulamu bwange ne balaba oba nalwala mutima oba kibumba oba nsigo omuli agamba nga prostate kati ne bakebera ne bagamba obulwadde bwe tutannabutegeera tugira tumulesse nebaza dokita Fred Okuku dokita oyo Okuku yankebera musajja mukulu nangumya naŋŋamba nze ndi dokita nzijanjaba abantu guma musajja gwe togenda kufa naŋŋamba obulwadde bubadde bwakakukwata ogenda kuwona namugamba nze mpona ati ye nawulira essanyu kati bo be baali bamanye nzijanjaba kubanga nze nali mu ssaawa yakuuba yakufa era n'abanda banga bonna bamanyi nafa naye waffe bambikako nti nafudde naye nze sifangako wendi kati neebaza nawonye badokita baŋŋumyanga nali ngenda kubeera mu complete failure nga ntidde nnyo ne baŋŋamba guma kansa waakyali mutajja kuwona era mbeebaza naye ekyannyamba okuwona naguma nga situlembolinga kankana mutima gwange nga buli budde nina wiiringi ŋŋamba nja kuwona era njogera mazima n'ab'owaka mukimanyi mujja kundaba buli omu ne ku kyalo mwenna nababuulira dda naye nga temukisuubira nti nawona kati njogedde mu ggwanga abasawo nabo beebaza basanyufu nze ndi musawo wa kinnansi naye abantu bange bamanya emyaka gye nkoledde obusawo nga nzijanjaba abantu sirina nnyo nsobi ze nsobola kukola ku bantu anjagala nnyo abantu babeere abalamu kati ate ekinnyamba taata ne maama bansomesaako mu masomero nasomera mu bannakalooli brothers ekiteredde gye nakoma mu kusoma kwange nasoma biology chemistry ebiki n'ebirala byonna kati nakimanya nti obwo obulwadde sisobola bujjanjaba nenzija mu ddwaliro nsaba abantu mwenna n'abasawo mwenna ab'ekinnansi abajjanjaba abantu bwe mulaba abantu ng'obulwadde temubasobola mubuleke kuba nze nandifudde seegeziwaza ku ddagala nakimanya nti obulwadde sijja busobola si bwange saabusomerera kati mulaba mponye munnammwe munfuula ekyokulabirako mu ggwanga singa nange nagamba kanywe eryange nandifudde naye mbeebaza abasawo mwebale nnyo njogera mazima ndi muntu mukulu sirina kinnuma obulwadde bwakkakkanye neyanzizza neyanzeege eyalwalako yali mukulu wange gwe nali ngobere baali bamuyita Rovito Kaweezi obulwadde obwo bwamukwata okugulu nazimba twali tukyali bato ye bwamala emyaka 35 naye kyamutwalira ebbanga okugenda okwejjanjaba yagendayo nga bukuze dokita bagenda omupima e Masaka teyatuuka ye Mulago bamugamba obulwadde bwalwawo na oluvannyuma n'afa dokita akiŋŋambye aŋŋambye naddala abaana abalenzi naŋŋamba kati waliwo abali myaka 3 mu giijo ngenda kubabuulira kati kuba nange nali sikitwala nga nsonga nga nange sibumanyi sibulwalanga naye dokita ono Okuku andagidde bwe naddayo ntegeeza abaana bange bagenze bakola abatuuse emyaka 20 bwe bati bagende nabo beekebeze babakebere nja kikolako era nsaba abantu abalala bali mu byalo abalwadde muyambe abantu n'abasawo abali mu byalo n'abasawo abazungu mulimu abaagala ssente nnyabo n'asibaawo omulwadde naye ng'obulwadde abutegere tajja busobola bujjanjaba. Nakyo kintu kikyamu. Muyambe obulamu bw'abantu, mubajjanjabe mubafuwadinge mubasindike ewalala nga nze bwe bampositinze. Dokita Lubowa naawe nkwebaza gwe wansindika e Mulago ow'Endejje ojjanjaba abalala kuba otegeera ky'okola ssebo nkwebaza. Toba ggwe nali waakufa, nze nali mu ssaawa mbi nnyo. Dokita yaŋŋamba oyo sisaasobola kuweza nnaku 3 naye kati laba nze njogera ku baamawulire. Yeebale nnyo Dokita Lubowa. Nja kusookera ku basawo bannange, abasawo b'ekinnansi mwenna. Ate mujja kummanya kubanga nze mbadde chairman wa district ku mulembe gwa Muzeeyi Ben Ggulu. Namaze emyaka 7 nga nze ntwala district era akayiyo nga nze nkuliramu abasawo b'ekinnansi. Nakati nkyaliyo. Abamu bambika nti nafa gye ndi. Naye mbakubiriza bwe mubanga mukola emirimu mugikozesa amazima n'obutuufu. Omulaba omukyalo oba alwadde mu nabaana ebyo tetwabisomerera, tulina endwadde zitukolako naye ebya nabaana temubajjaako ssente. Prostate omuntu oyo bw'aba musajja aba takyasobola kufuuyisa bulungi, mmwe abamu mugitwala nti nziku, obulwadde buba bungi teziba olumu nziku, omuntu alwala mu ngeri ye. Dokita be balina okukakasa bano ab'omu malwaliro ng'e Mulago, kuba kati nze mundaba nze ayogera mummanyi ndi musawo wa kinnansi, buli omu ammanyi. Singa nadda nange mu ebyo nandifudde. Kale mbakubiriza n'abasawo b'amalwaliro abamu bakola naye siba ku mulwadde ng'amulyako ssente ng'obulwadde tabusobola. Mubaforwardinge mu badokita abakola Masaka gye bali Mulago. Kati mulabire ku nze mujja kundaba nze nkyakala ndigidda nawonye. Nebaza abasawo ba Kibale community, mwebale nnyo nammwe mwebalire ddala era bwe munandaba nga njogera mukimanyi mwanzijanjaba. Nerakayi ku disitulikiti nenebaza Dokita Katwire Kyotera naawe weebale nnyo, ne Dokita Wattimerakayi n'ab'e Kampala mwenna n'emikwano gyange, nenebaza abantu b'ekitundu bonna n'ab'amagombolo amalala abaaliwo obuyambi bw'omwampa. Era nzizemu okwebaza mwebale nnyo mwebalire ddala n'abansabira mu ssaala zammwe n'abampa obuyambi. Nebaza ab'omu maka gange, bakyala bange n'abaana bange n'emikwano gyange mwenna ku kyalo ba Mwami Lubembe, mukyala Lubembe Kyawanyana n'abalala bakamya ba Mwami Kimuli, mukyala Kimuli, Basansa voice wange ndi chairman w'erosi ekyawanyana nze mbatumidde mwebali kunsabira nawonye. Naye President Ssebo weebale nnyo omulimu gw'okoze Mulago, tulya bulungi, abasawo batulabirira. Ssebo kye neebaza kyennyongera kyembadde neerabidde President w'eggwanga, abantu baweereza amawulire amakyamu nti abasawo tebajjanjaba e Mulago. Ssebo abasawo bo be watuwa bajjanjaba kiro misana. Mwebale nnyo abasajja n'abakazi abaasoma ebitabo okutujjanjaba, nange nempona nensitaba nga mbeera mu famire yange n'okuyamba abaana bange. Mwebale nnyo President, weebale owangaale ku nsi Ssebo w'ekitiibwa.
You're watching Health Garage.
We're already going through a very huge number of patients right now as I speak. Men are pouring here at the Cancer Institute, and all they are coming is to come and check for prostate cancer. So if you haven't come, the services are available. They are free of charge, and we want to encourage you to take this chance. If you're not able to come, go to the nearest health center where you can get some help. Thank you.
Dr. Okuku's expert insights underscore the urgency of addressing prostate cancer. Men, take action. If you experience urinary issues, have a family history, or you're over 40 years, get screened. Subscribe to our YouTube channel, follow us on X, and like us on Facebook for latest educative health content.
The Health Garage, transforming lives one healthy choice at a time.